area of the hand. Can I borrow your hand, please?
Yep.
So, other than the fact that it's on the other half of the body, what else is different about this? Smaller joints, yep. And how is the condition itself different? Oh yes, it affects women a little bit more than that, but that doesn't help Ryan right now on my table with rheumatoid arthritis in his hand, okay? But you're right. How would the condition present differently in his hands with rheumatoid arthritis than his osteoarthritis of the hip? It's probably happening on both sides, yep. Inflammation. It's an inflammatory condition, remember? So instead of more direct joint lobes, just increasing space on the joint, we're going to take into the consideration of protocol for inflammation, which means we're going to be trying to flush things out. And a lot more flow is related to this treatment. Okay, so we did our face down treatment, we worked on his upper back and shoulders. Now we can do a little bit of work in the proximal aspect of his upper back and shoulders and arm here. And as we work our way down into the aspect of the arm that he's complaining about, stiffness in the hands. So again, I'm just doing gentle compressions. I'm not doing anything too crazy. If I had lotion. Oh, yeah. A wheelie chair. Thank you so much. So with this, we're going to be doing lots of flow conditions. If we notice that his hand is a little bit inflamed, what is something we can do to help give a little bit of relief in those joints? It could be, I could provide a little bit of relief, but specifically directly to the joint. When they're currently inflamed, I'd be a little bit conscientious about that. It's a cool application. So if I can get like a cool towel or something, drape it over top of their knuckles, right? Can help actually decrease that irritation happening, which will make local treatment to the area a little bit more tolerable for your patient actually. So often when it comes to rheumatoid arthritis, Ryan, chime in if you feel like you've experienced something different, but the patients, they probably aren't going to come to you with asking you to help with their specific rheumatoid arthritis symptoms, because most of them will have just accepted it as a part of their daily life, and they'll probably see you for other stuff. Like, oh, I've got tight shoulders because I had to do a lot of cleaning out my pantry this weekend, or something that's actually not directly related to the area of their concern, area of their disease process. Okay, so let's say he's not currently experiencing flare-up, but we can see he's got some deformities happening in his joints here. They're stiff and they're kind of bulbous in nature. So what can we do to try and decrease the stiffness in his hands? Not inflamed. Joint mobs. There you go. Which joint mobs do we not want to do for this person? Gliding or shearing forces. But what types of joint mobs can we do for this patient? Distraction, long axis distraction. So I'm actually already starting in with his shoulder, with his arm. So I'm not just gonna start with distractions right in the targeted area. I'm gonna make sure I'm challenging the entire limb first. Right to the shoulder, gliding motions down the arm. And then we can start to do segmentally. I'm gonna start closer to the wrist, try and distract those wrist segments. Directly above the next joint, I'm gonna go just a little bit above. I am not going to reef on this joint. Very gentle traction. Okay? As you can see, I'm not pulling super hard. It's just very gentle in its application. After I've done a few rounds of pull, release, I might move on to the next joint with a gentle pull and release. Gentle pull and release. Once you've done them segmentally, that's when you can possibly go in and just do a traveling distraction. Because most distractions are stationary. You pull, you hold on, but this one I'm gently sliding off of his thumb as I'm passing over, like so. Good. And then usually I go back and forth from one side of the hand to the other just to maintain balance. I just go back and forth. So then I'm gonna go onto the lateral aspect of the hand. I guess that's the medial aspect if we're thinking anatomical neutral. So the pinky side of the hand. I'm gonna start with local distractions at the wrist. Good. And if you can, try and incorporate more body leaning back. I'm not doing this, right? I'm not pulling with my upper body. I'm stabilizing with my upper body and doing a little pull, yes, but it's mostly the leaning with my body that's doing the tractions. Good. Once I've done the lower segments, I can move up to the next segment of his finger. And again, you're not gonna be pulling too aggressively. It's very gentle, just enough for you to feel that you are creating space in that joint. And because you're dealing with an inflammatory condition, you wanna check in with your patient. Ryan, where are we on the pain scale with me pulling on your finger like this?
At the end, it's, 3.
Is that 3? Nice. All right, so I'm not pulling very hard at all. All right, and then we can move on up to the next joint. Very gentle, traction, distraction, and then again the last point. So once we've done the segmentally, again I'm gonna go back and do kind of like a moving distraction. Good, and then once you've gone and done all of the fingers, let's say you've created space in all of their joints, what's something that you can do after you've helped to create space in the joint? Oh, that's what I'm doing right now. After that, what's the next step?
P-ROM.
Pain-free P-ROM, exactly. So you can start challenging the joints of the wrist a little bit. We'll go gently into flexion. We're okay, right? Good. We're gonna go gently into extension. Good. We're gonna do some radial deviation. Ooh, clunk, clunk. And ulnar deviation. And then we can do the same with the individual joints as well too. So not only am I doing a gentle P-ROM, but I'm actually doing a little bit of distraction with it. Right? So it's actually, if it seems like this treatment protocol seems pretty simple, it's because it kind of is. There's not much that we can do to help with their actual arthritis, right? So there's not much in terms of remedial techniques that we're gonna do. Okay, let's say we've gone through, done pain-free P-ROM, we've done all the distraction and everything. What's the next step? We just drop it and go? I would hope not. I'm gonna flush out. Yeah, exactly. I'm gonna flush things out, maybe do some compressions, and then what's the last thing I can do after doing some gentle P-ROM to help encourage the idea of stability or stabilizing those joints? Activate those muscles, exactly. So, Ryan, I'm going to get you to close your hand into a gentle fist. I'm gonna get you to very gently try and open your hand against my pressure. I'm gonna let you win though. Go ahead and push, 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 push. Good, all the way, all the way, all the way, good. And I'm going to go ahead and push you back. Please let me win. Okay, and 5, 4, 3, 2, 1. Of course, I would check in between each of those to make sure it wasn't painful in any way, shape, or form. I knew it wasn't gonna be painful for him, but you check in before you make it more complicated, right? Okay, Ryan, go ahead and open your hand against my resistance. Good, all the way, all the way, all the way, all the way, good, and let me win. Ready, 5, 4, 3, 2, 1. So I actually do a lot of going back and forth between concentric and eccentric contractions, back and forth in practice. As long as it's pain-free for both of them, it's a really good way to challenge real-time the structures that you're trying to target. Okay, so any questions about what else we would be applying for this treatment? So if it was rheumatoid arthritis of the hands, where would my treatment probably finish? The most proximal aspect. So I would suggest finishing off with a little bit of the upper back and shoulder. And if you can, if you have enough time, finish off with a little bit in the neck. Just because arthritis is stressful. I would assume. I don't have it, so. Right. Any questions?
Can you do the pack?
Okay, you could. But keeping in mind specifically for rheumatoid arthritis, you don't want to do anything too vigorous or anything that's considered too intense for patients. And sometimes pec work can be quite intense. So if you can do it gently, absolutely. I would consider that as part of the proximal component of your treatment. Yeah, good question. Any other questions? Yeah.
When we do the distraction of the arm for the joint,
Yeah.
can we during we do the distraction, can we do some gliding movement, flexion, extension, and for the joint?
So you can, I would just say careful about adding your gliding motions during your OPs, just for the sake of making sure you're not doing gliding motions. But in real world practice, as long as you're applying a distraction, absolutely.
Yeah, maybe it can make the muscles around the joint feel, the release or.
Yeah.
You can benefit muscle, I think, if we do the.
Exactly.
The
Yep.
normal movement.
And that's why we do that in practice, but not necessarily for the OPs, just for the sake of your examiner knowing no gliding motions, right? Yeah. So the way you can employ that same mindset in a way that isn't considered possible risk of harm is we do distraction, pain-free PROM, contractions in that order. So kind of, sort of, but yeah, I like to combine methods, but just for the sake of making sure that you're following proper safety for the patient, it's best to do them individually for exams. Good question. Any other questions? Wonderful. Where are we at for time? Okay, cool.